are looking at a number of interventions. So we're looking at the intervention in Rajasthan with the miners. We're looking at the rag pickers and also with Sodna and a couple other projects. So we're trying, there's so many different projects. So what kind of recommendations can we give them in regards to health? And we had this question of how do we convince people, right? And what kind of interventions? So in India, it is very common for NGOs to have health camps. The question is, are they effective? And how do you make these programs very effective? So, and this involves a little bit of, we do like action research, so I'm working directly with a number of people, but we also try to bring in some sophisticated modeling. So we want to understand one thing, and I think we're very convinced about that, is the role of groups. Because Harish, we were there at the rag picker, and we started talking about groups, and they didn't have groups. And they were so fundamentally different from your self-help groups. And I think the key to change is groups. Groups are, we're talking about politics. Groups are immensely powerful. You organize them, they can make change. Individually, you can't do anything, okay? So, let's, please. So, you're wondering, what the heck is all this? Okay, so, this is the theoretical basis, and this basis has happened after talking to different of our officers. I call up people and say, so, we come up with an intervention, and we're trying to figure out which intervention is effective, and on what population. So here, we have some evidence that a strong group, so we want to have people wearing masks, okay? It's very easy to say it, but will they do it, okay? So the assumption here is that the uptake amongst groups, and groups doesn't have to be self-help groups, but really active groups, people that are really engaged, they meet all the time. For example, I do yoga. Now, I'm the only man that in our female group, I'm a token woman. But I tell you, we're a very tight group. Right? And if somebody's sick, we'll go and grab them and take care of them. There's that, and because we see each other all the time, it's immensely powerful. So, not only that they will pick up a lot faster, but it will actually have a much better result. Likewise, but if you look at a weak group, because I was thinking the rag pickers, I thought they were powerful, but I'm not convinced about that. At least we went and met, we were talking about, or maybe it was not the right sample. But when I was talking to the women, I said, they had to move. In Radisson, they had their go down, they got kicked out, and they moved elsewhere. And they said, well, didn't you work with a group? And they said, no, we don't. So maybe they're not the right people, but at least that individual didn't take advantage of the group. Okay? So that's one thing. Okay, so compliance rate by group. Do another one. Okay, there are different types of diseases, and this is what we're trying to really get a handle on. And it's so simplified, because it's not one disease, there are hundreds of diseases, thousands. Actually, the bacteria is going to look, there was a lecture about how long we've been in this world. I'll tell you something, the bacteria will look at history and say, oh, there are these humans, they really helped us a lot, in a little time frame, if you catch our drift, okay? They made this ecosystem really great for us. But, and this is a little speculation, that non-infectious diseases you can pick up early and a little higher, while as infectious diseases. Some diseases are complicated. So this is a complicated disease like TB, whereas an uncomplicated disease, the uptake is different. So maybe I should talk complicated and uncomplicated. Okay? So do another clip. So this is what we wanted to do. What kind of intervention should we have? So there's some NGOs that will put up big banners, big publicity, and then talking to people. That's not very effective. You can put all your money in a health camp, right? One time, and the learning. It's like many of you are students, right? And if you just go and have one-time interaction, it's not going to stick in your brain. But if you have something periodic, it'll grow on you, right? So we are looking at, we kind of hypothesized and also discussions with people is, if we, and instead, you can take money and you can do a seminar like one day. It's quite intense, right? Or like today we have seminar, it was 8 hours. Or we could do that 8 hours, once a month, or we could just spread it out, the same resource. So I'm not giving any more resources, it's just how we allocate the resources. One big resource one time, or just allocate it, okay? So these are the different allocations and the uptake, okay? Continues. So, some of this evidence goes from one of the projects we were doing in Andhra Pradesh, another project, not the one with Harish, and they did this campaign for hygiene. So, I really thought it was a pointless campaign. I can be very critical of even they went and made these signs, and the kids were walking around. This is a village where there's no roads, electricity, and the parents are illiterate and going around with signs about cleanliness. It's, I think, irrelevant. Okay, it doesn't make sense. But data campaign, what does that make a difference? However, the kids are now having to wash hands. That's having an effect on the parents. About 15% of the people do that. So there are different ways that we can look at that. So whether we're doing it continuous, and continuous is a little different. It's not just periodic. It's an embedded approach. So we actually take the structure at the local level and feed it. So it could be your self-help group or the minors group, I don't know. But it's a fundamentally different approach. It's an embedded approach. So we ran some simulations. But okay. And I also I called you up, Taji, and I asked questions. Now, I'm not sure if this is an exact representation, but there's also difference of type of, there's difference between organized and unorganized. And the reason I call it organized is some of the miners have started their own business, right? I call them organized because they have some capital and they're taking care. And you said, if I have it right, that those people, in fact, were much better at their own health, in the health of their workers. So there's a difference about that. And also, it depends on the type of work. Sandstone vs. marble, right? The affliction rate is a little different. So it's also the interaction of not only the type of groups, but the type of environment too. Okay? So we were looking at that. So we're looking at types of groups and environment. Okay, so click. So we ran these simulations. And what was interesting is that we ran like continuous, 3,000 a month, periodic, 20,000 quarter, and 60,000. And we found that, I know this might be a little confusing, but I want to have a little discussion about this, is that the embedded approach, and this is like some nonlinear simulation optimization. The embedded approach was by far much more effective. And not only that, this is very interesting. We cut many NGOs. Do you ever see your funding go down? Yes. Okay. This is all of it. So you'll get funding for a couple. Then we found that even if the funding goes down and down and down, the continuous one will keep on yielding results. Okay. So what does this mean? Okay, let's click. Oh, one other thing. This is a little fancy kind of things, just to impress you, The other thing what we did was we changed our budget allocations. And we also saw that it's a very dynamic thing. Many NGOs are focused on treating one disease in one group. However, it's a little more complicated. Each group has a different cost-benefit structure. The self-help group members have a different cost structure than the non-self-help group by disease type. Some are more resilient, some have bigger losses, so you have to account for that, right? So those are some of the things. So what we did was we changed the allocation, and you can see that you might not see, this is the ones indicate where the money should be applied, right? 0 is not. But small changes, and what it means is that your modeling, you should not be just sticking to one intervention, means one population, one disease. Your intervention needs to be dynamic. It needs to be reflective of the environment. Okay, so that's what we're talking about. So let's click. So 4 concepts that I can share with you. One, if you want to set up a healthcare system, and we want it to be effective in the long run, build it into your system. So, like right now we've set up the schools, and then the healthcare, it's really not embedded, it's more of a quarterly system. Is there a way, and then we actually talked to the school teacher, and we said, do you want to be a healthcare worker too? Well, she got really excited, you know. She in the Indrapuram, right? She's quite a talker too, you know. But she got excited, and maybe you could learn from Sodna how you're encouraging that relationship. See, people want to, you know, if you're a teacher and then you get a little extra money, another 1,000 rupees, and then you can do a little healthcare. You know how much that builds to your, you know, overall sense of who you are and what you're doing in the community, and you're being effective, you know. So that's number 1. Then, firm belief that self-help groups, or let's not even call self, groups are really, really important in reducing the total cost of your healthcare system and making sure the population is healthy. So if I'm trying to put health, maybe the trick is, let me make the groups, instead of investing in healthcare, maybe I should invest in getting the groups to be more active. That inherently will have an effect, okay? Or maybe both. Okay? Do not be focused on a single disease. You know, we worked with another group, we funded, and they've done well. It's called Save a Mother. It's to prevent maternal and infant mortality. But they've grown and they've developed, and what they've done is actually, they're also doing TB. You can't be just focused on, I know it's very simple to sell one disease, but reality is you have to reflect and change to the needs, okay? And then even when the budgets are cut, you need to you know, keep focus on the continuous approach, because that will yield the best results. It'll be, you know, you can cut the budget down by 50%, 70%, and it'll still outperform. Up to the point that it just doesn't have enough money, and that's it. So this is some of the simulations we ran. I don't know, I mean, I'm trying to bring some relevance, and I want you guys to question me. You know, don't take this as truth, because these are computer models. Okay, question.